Research in diagnosis, genetics, and drug treatments is moving forward rapidly, making it an exciting time for scientific discovery in Alzheimer's disease. I'm delighted to welcome both Dr. Fleming with Florida Hospital's Geriatric Assessment Center and Dr. Curtis, who specializes in Alzheimer's research at Compass Research, to share the latest in research findings. Welcome, doctors.
Thank you.
And Dr. Fleming, get me started by explaining the difference between dementia and Alzheimer's.
Sure, I'm often asked this question because there is confusion out there. Dementia is a general term. It applies to anyone who has cognitive loss from either memory or thinking or planning, but it can have a number of different causes, as Dr. Curtis knows. It can be due to frontotemporal dementia, Lewy body dementia, vascular insufficiency from circulatory problems, or the most common is Alzheimer's, which is a specific entity. Alzheimer's disease is one of the most common cause of dementia.
A few years ago, where were we in Alzheimer's research?
At the time, we were focusing on the main culprit, we believe, that causes Alzheimer's disease, and it's a protein called amyloid. We were really focusing heavily on attempting to either remove it or slow down the production in the brain. We were looking at a lot of different ways, and we really still don't know, but we really didn't know what the best way was to attack this disease.
Now, I have heard the term biomarkers used. Tell me what that is and how is that involved in the research?
So prior to a few years ago, the only way we could really diagnose somebody with Alzheimer's disease was to watch them decline for a 10 to 15-year period. And then when they passed away, we could actually look at the brain and see if there were the telltale signs of Alzheimer's disease. Well, now with biomarkers, we're able to see the signs of the disease early, decades early, both involving PET scans and involving spinal fluid. We can actually see what we think is the bad causative agent.
All right, so is the PET scan then a new dimension?
It is. The PET scan was developed approximately a decade ago, and we've been using it in research for the past 10 years. And last year it was actually approved by the Center for Medicare and Medicaid Services to be used as a diagnostic aid in someone who has a cognitive problem. And we can use the PET scan to see if the brain has the amyloid, which we believe is the causative agent. And so the PET scan can help us make a diagnosis. It's not the only tool involved, but it's a very, very important tool.
Dr. Fleming, why is early diagnosis so important?
You know, the standard model of treatment in medicine is to understand what happens in the disease process from normal to disease, what we call the pathophysiology. What is going on at a microscopic level, at a chemical level, and we rely on this level of research to teach us that so we know how to best to treat or prevent a disease like Alzheimer's.
Now, you have mentioned the amyloid, Dr. Curtis, and I understand that some of the recent research has been a little disappointing.
Well, we've had some disappointments, but we've also had some, I think, some really positive results too. So what we're dealing with, we believe, is a buildup of this amyloid over time, 10 to 20 years before the disease starts. So what we're trying to do is focus on ways to either remove it or slow the production. One of those ways, and the most promising way that we've been looking at over the past, I'd say 5 to 7 years, is actually trying to use the immune system to remove it. And that's where we've seen some successes lately. I would say successes, but be very cautious about that.
We're running out of time, but tell me, can I do anything with my diet that might help?
Yes, we think so. The Mediterranean diet, in a recent trial where they looked at patients over 5 years, and they gave some a Mediterranean diet, which is fresh fruits and vegetables, lean meats, including poultry and fish, olive oil, red wine in moderation, and we looked at a regular diet. It did show that patients after 5 years that followed the Mediterranean diet did do better on memory testing.
We're going to have to stop at that point. Thank you very much, Dr. Fleming, Dr. Curtis, for being with us. Well, Drs. Fleming and Dr. Curtis have come in and they have updated me on new Alzheimer and dementia research.